In my last video, I told you about how prescribing rights could come to physician associates. This could be through the PSA exams or bro sits before they can actually prescribe the V300 non-medical prescribers use in the UK. Or, like our OGs, they take the PAINS exam, they come out and able to prescribe. The funny thing is, we cannot prescribe as of yet because of the lack of regulation. But we can still amuse ourselves. There are a whole lot of physician associates out here in the current market from all sorts of different backgrounds. Do all these physician associates want the right to prescribe? It seems obvious, but to me, it's not a foregone conclusion. It reminds me, back in the day, long time ago, nothing close, long time ago, I used to know this lady. Valentine's Day was coming, the boy had to show his romantic side, trying my best to impress. Went to Asda, Waitrose, trying to get me some nice chocolates, some flowers, one of those postcards where you write your stuff in there, becoming all Shakespearean. I put in effort, right? I show Shorty the flowers, I show Shorty the card, I give Shorty the chocolate. Mind you, this is long time ago, where I get myself into trouble. I'm to find out, this girl doesn't even like chocolate. Since when did women stop liking chocolate? Chocolate, I thought that one you couldn't miss. Nah, bro, that's the same thing. You might think the fact that someone is a physician associate means they want to prescribe. Some people just don't want that responsibility. They want to be able to see a patient, think, I don't know, they have a UTI, an ear infection, the doctor prescribes and that is fine and dandy. A paper set out to see if physician associates really wanted to prescribe. The paper was talking about surveyed 123 physician associates, about 34% in primary care, 66% in secondary care. I was surprised by that, to be honest. I thought most of us were in primary care. These physician associates in question had qualified between 2019 and 2021, so they were recent graduates. And when these bros were asked if they indeed wanted to independently prescribe, about, let's say, yes! There is a difference between wanting something and having the ability to. For example, if you told me, Oti, do you like Beyonce? I would say yes. But ask yourself, do I have the requirements? Do I have the capability? Do I have the accoutrement to be able to maintain a woman like Beyonce? The answer is no. I ain't got it like that. The same thing goes with prescribing. These physician associates were asked, do they think their training adequately prepared them to be independent prescribers? 35% said, my course actually prepared me for me to be an independent prescriber. However, I would like some more experience on the ground before I start prescribing independently. Others were like, nah fam, my course didn't prepare me at all. I don't think it's enough for me to be an independent prescriber. And about 28% were like, listen, my course prepared me and I'm ready. Even with doctors that have had the PSA, when they get onto the actual wards initially during their early foundation years, I don't think they're all that confident in prescribing independently. With practice and experience, you get the hang. It looks simple, like you just write the name of the drug, take it 4 times a day, and it's boom. But when you think about interactions behind that, you have to consider the illness the patient has, renal disease, because of that their GFR is all messed up. It can be a bit daunting, but that makes sense why some people, though they feel that their course adequately prepared them in terms of the pharmacological knowledge, they still acknowledge like, bro, I still need some hands-on experience before I can be left out here just writing scripts. Some of the peers surveyed felt like lack of prescribing rights was really affecting their relationship with their colleagues. They feel like they're a bit of a burden, as in they need a medication, they have to stop doing what they are doing, go look for a colleague who also has to stop doing what they are doing to sign them the prescription. And especially when it comes to junior doctors, some rightfully want to review the patients themselves before they do the prescribing, because once they prescribe, they are responsible for their prescription regardless of what the PA said or might not have said. The PA will be held responsible for his actions, but the doctor signing the prescription in question will also be held accountable for their actions in the prescribing. Not everybody is comfortable with this, especially when you first begin, and this becomes an additional workload. Not only that, some felt that because of their inability to prescribe and other ionizing radiations, they are sometimes looked over and other allied healthcare professionals like ACPs are preferred to them. There was a paper I read in the past looking at the opinions of consultants, and one of the factors that hindered their desire to employ physician associates was obviously the lack of prescribing and the lack of ordering ionizing radiation. I think in primary care it's less so. Go to EMIS messages, I need this medication for this patient because of A, B, and C. If they agree with you, they'll do it. If they don't agree with you, they'll call you over, explain yourself. Why this and not that? And it's also a moment for you to learn. Problem, I suppose, is secondary care. Everything is moving 1,000 miles per hour. Your designated supervisor might not always be near you, so it can be a bit iffy sometimes. Physician associates do really want to prescribe. They just don't want to come out straight out of the box and prescribe like our OJs in the USA. They want some experience, 6 months, a year, then maybe they see the PSA exam, and once they are deemed safe to prescribe, they'll be more than happy to prescribe. You just have to cross our fingers and wait for the regulation to be done, and once regulation is done, the bros can prescribe in these NHS streets. Where do you stand? Let's see how this pans out. It's your boy OT, and I'm out. Salute.